everyone. Welcome to today's LINEA webinar. This webinar will be on key ethical considerations when carrying out research involving children, and Dr. Nambusi Kyegombe will be presenting for us. First, just a little introduction for anyone who's new to this webinar series. So as many of you know, LINEA is the learning initiative on norms, exploitation, and abuse, and we're based at the Gender Violence and Health Center at the London School of Hygiene and Tropical Medicine. And our aim as a network is to foster the use of the social norms approach in preventing the sexual exploitation of children and adolescents. And so we organize regular hour-long webinars covering different aspects of social norms, structural drivers, and the sexual exploitation and abuse of young people. So we do those every other month. So for now, I am pleased to introduce Dr. Nambusi Kyegombe. Nambusi is a lecturer in global health and development at the Gender Violence and Health Center, where her research focuses on violence, HIV, livelihoods, and social and structural determinants of health. Nambusi is also a researcher with LINEA, and so as part of that work, she recently conducted a formative study looking at adolescent vulnerability to transactional sex and sexual exploitation in Uganda. Today, Nambusi will be discussing key ethical considerations when carrying out research involving children, and she'll be using the ethics protocol from an evaluation of a Good Schools toolkit, which was a program in Uganda to improve the environment in schools, and she'll be using that as a case study to talk about key ethical considerations. So her presentation will be about half an hour long, and that will be followed by time for questions and answers. So with that, I'll hand things over to Nambusi. Thank you.
Brilliant. Thank you. Thank you very much, Rebecca, and welcome everyone to this LINEA webinar. I'm really excited to be able to discuss this topic, and I'm very much looking forward to the discussion because I'm sure a lot of people who will be on this discussion will have experience of researching with children, so it will be a great opportunity for us to share and learn from each other. And as Rebecca mentioned, I have done work with children on a variety of projects. I've looked at the impact of HIV on households, violence against children in schools, which is the case study I'll pick up on in a second, transactional sex and sexual exploitation, including with children or involving children, as well as work with children with disabilities and their access to social protection. And I'll be using the work that I've done on violence against children because of the link, the direct link with child protection issues. But that's obviously not to say that all research doesn't have child protection issues. So in terms of what I'll be discussing today, I'm sure some of this won't be new to a lot of you, but I'll start with a short history on ethics, where it came from, research ethics came from, before looking at general ethical principles and ethical guidelines. As I mentioned, because I'm using the work on violence against children as a case study, I'll just give a little bit of background about violence against children and where the research field is now for anyone who doesn't currently work on violence. We'll then quickly look at key ethical issues and then think about the particular vulnerability of some children. An important consideration in conducting ethical research is researchers' welfare. So we'll touch on that briefly before presenting that case study. Great. So I'm not sure how familiar people are with the history, but in 1945, so following the Second World War, an American military tribunal was opened to bring criminal proceedings against 23 German physicians and administrators who had participated in war crimes and crimes against humanity. And this was related to work that they had done with medical experiments on thousands of concentration camp prisoners without their consent. Now, most of the subjects died or were permanently disabled as a result of this research, and this actually resulted in the Nuremberg Code. And central to this code is the idea that the voluntary consent of human subjects is absolutely essential for research. Essentially, it makes it clear that subjects should give consent, and that the benefits of the research must be outweighed by the risks. Now, though the Nuremberg Code was the first step, it had limited effect on research and because the medical professionals felt that it was implicit to US researchers, so sort of only relevant to them, and it was also considered or perceived to be a description of criminal research, so essentially how not to do research. And it also missed out many aspects of research, so it didn't have the impact it could have had. Now, another very famous example of unethical research, or something that was part of the genesis of where we are in terms of research ethics, was the Tuskegee syphilis study. Unfortunately, that's not the only one, but this is one that is often cited. It was conducted by the U.S. Public Health Service between 1932 and 1972, so until quite recently, in fact. And it involved 600 low-income African-American males, 400 of whom were infected with syphilis, and were monitored for 40 years. Now, they weren't infected by the study with syphilis, but they acquired it just in their day-to-day lives. And although free medical examinations were given, subjects were not told about the disease, even when penicillin, which was a proven treatment for syphilis, became available in the 1950s. Now, what happened was many of the participants, not even participants, people who were in the study died of syphilis during the study or passed it on to their partners. So again, this was identified as a violation of research ethics and something that the world accepted mustn't happen again. Now, fast forward a few years, or at least during the duration of the study, came in 1964 the Helsinki Declaration, which was a declaration by the World Medical Association. And this essentially was a reinterpretation of the Nuremberg Code, and it established recommendations for ethical research involving humans. What was an important development here is that journal editors required that research is performed in accordance with the declaration. And this declaration has since been revised several times and updated several times, but is essentially the basis of the research that is conducted now. So in terms of thinking about what general ethical principles guide research, there are three, involving human subjects, there are three basic principles. The first is respect for persons, and this includes respect for autonomy and confidentiality. So someone has the right to make the decision for themselves, whether they are to participate, and if they are, that their participation is confidential. And this obviously has implications on people with impaired or diminished autonomy. And children are often classified or considered as people who may have impaired or diminished autonomy. We'll pick up on that in a second, but this is a particular consideration for children. The second principle is beneficence. And essentially this is a need to maximize the benefits and minimize the harms. And in terms of how this is assessed, it's related to an assessment of whether the study is a reasonable risk in light of the expected benefits, that it is of sound design, importantly, that the investigators must be competent to conduct the research. Otherwise, essentially, you're just putting people through a study when the people who are doing it aren't even competent to do it. And there must be safeguards for the welfare of research subjects. And related to beneficence is non-maleficence, which essentially is do no harm. So there should be an explicit and cognizant effort to make sure that the study does not do any harm. Finally, the third general principle is justice. And essentially this is a need to ensure that each person is treated in a way that is right and proper, and each person is given what is due to him or her. And as part of this, the selection of subjects must also be equitable. So if there was a study, for example, for which where the risks were unknown but the benefits were calculated to be better, if the subjects were selected from a particular ethnic group or socioeconomic class or something, that would be an inequitable selection of subjects and would therefore be unethical. Okay, so how are these three principles actually applied in practice? The first, which I'm sure won't be new to anyone on this call, would be informed consent. And essentially this is a requirement that to the degree that they are able, subjects in research must choose what shall or shall not happen to them. And as it suggests, it must include information, and people must be able to confirm that they understand the information and therefore give their consent. And importantly, this consent must be voluntary. There should be there shouldn't be a coerced consent. And as I just mentioned, application of these principles also requires that there is an assessment of the benefits and risks, and this principle is also applied in terms of how the subjects are selected. So there shouldn't be an inducement to take part or an undue inducement to take part for somebody to take part in the research. Okay, so in terms of trying to put all of this into practice, there are a number of guidelines which which are designed to guide a whole variety of research. And in terms of guidelines on violence against children, there are several, some from civil society organizations, from government organizations, from different sectors. And they are crucial. Ethical guidelines are crucial when carrying out research on violence against children, or indeed any research, particularly that involving children. And the value of the guidelines is to help to minimize the risks of potential harm that may result from the process of collecting the data. And this could be risk to the participants, to the researchers, or to others who are just generally involved. For example, if you are interviewing about experiences in a healthcare setting, could healthcare workers be put at risk by their participation? And the guidelines also help to ensure that any remaining risks are outweighed by any potential benefits. And an important and perhaps obvious thing is that research ethics and methodologies are closely linked. For example, through ethically sound research protocols and tools, essentially to ensure that the questions you're asking and how you're asking them are ethically sound. So as I mentioned, we'll be using violence against children as a research topic, and it's increasingly recognized as an important area of public health and social policy research. But unfortunately, there isn't sufficient evidence currently about the children's experience of violence, particularly in low and middle income countries where literacy levels may be low, but importantly, where child protection systems may not be well developed. We've talked continually about the importance of minimizing risks, and child protection systems are an important part of that. So if you want to conduct a study in a setting where these are essentially absent, should you be conducting the study in the first place? And another important consideration that has reduced perhaps the volume of research that could have been done is fear of causing psychological trauma or distress. Although having said that, very few studies have actually shown evidence of distress as part of the studies. Now, the United Nations Secretary General study on violence against children specifically calls for more investigation to provide up-to-date evidence, and researchers and donors are actually taking an interest in this. In fact, the Centre for Disease Control's Violence Against Children surveys are responding to these. They've been completed in 8 countries and are currently ongoing in several more, and they interview girls and boys and measure physical, emotional and sexual violence. And in conducting violence against children, most research, particularly if it's a quantitative study, which would be if it was epidemiological, consider asking young people to self-report their experiences of violence using predefined tools, and they ask about specific acts of violence, which is again where concern may be raised around child protection issues, but also around trauma and so on. So, as I mentioned, there are a number of key ethical issues. We'll discuss consent in a second, but then we'll also look at protection of children, privacy, and questions around payment. Should children be paid, or should there be payment for participation? Now, as I mentioned, there are several guidelines that are designed to help guide and give advice on how and when to make decisions around ethical research. And the Council for International Organizations of Medical Sciences provide guidance on ethical medical research involving human subjects. And their scope reflects the changes and advances and the controversies that have characterized biomedical research and ethics in the past. And a particular aim is to reflect the conditions and needs of low-resource countries. And research on cognition and capacity of young people, including adolescents and even younger children, has shown that young people have a significant ability to provide informed consent. In fact, mid to late adolescents, so those sort of around 14 years and older, have been shown to demonstrate an understanding of research and the cognitive ability to make decisions about research, which is similar to that of adults. So as such, both younger and older adolescents have been shown to reach decisions regarding research and participation that are similar to those made by adults. And guideline 14 of the COIMS guidelines involves research involving children. So what does this guideline actually say or state? Essentially, under this guideline, the investigators must ensure that research might not equally well be carried out with adults. This is going back to the question of diminished capacity or diminished autonomy to make decisions. So if it could have been done by an adult, then it shouldn't be done, the research shouldn't be done with children. And the investigators must also ensure that the purpose of the research is to obtain knowledge relevant to health needs of children, and that a parent or legal guardian of a child must give permission. This is commonly known as consent. But importantly, the agreement assent of each child has also to be obtained to the extent that a child is capable. We, for example, can't argue that a child assents to a vaccination. It's the parent who makes that decision for that child. But importantly, the guideline also makes provision for children's refusal to participate or continue and emphasizes that must be respected. But important consideration is, how is that then assessed? You know, if a child is dissenting, how do they express that in the context of power differentials? If your parent says it's a good idea, the doctor in front of you says it's a good idea, can a child really say, no, I don't want this, and to what extent would that be respected? So that's an important thing to be aware of. But in terms of children's ability to consent, the age of consent may vary from country to country or even within jurisdictions within the same country. And as I mentioned, research on cognition and capacity of young people has shown that they have an ability to make informed decisions about their participation in research, demonstrating that they understand what they're being asked and that they're able to make that decision. But as I mentioned, investigators must also obtain the permission of a parent or a guardian in accordance with the local laws and established procedures. An important consideration here is, to what age is it acceptable for a parent to give consent for a child's participation or ongoing participation in research? So if a child is expressing that they don't want to be part of the research, but the parent is suggesting that they should, the guideline would encourage that the research is stopped, but to what extent is that happening in practice? Now, we've been talking about a child and children throughout this presentation so far, but how are we deciding who a child is? Is this determined by age? A lot of international conventions define a child as anyone under the age of 18. But what about a 16-year-old who is married and is a mother? If you are asking her to interview her child, does she then need to get permission from her parent or her adult? And what is the developmental capacity of children to understand the question being asked? There is also a provision in a lot of ethical guidelines around emancipated minors, where somebody who's below the general age of consent is regarded as emancipated or mature and can provide consent without agreement or an awareness of the parent or guardian. This is particularly so in particular sensitive topics. So if a parent or guardian was aware of a child's participation in something related to sexuality or recreational drugs or something that would be considered questionable by the parent, this could put the child at risk of questioning or intimidation by an adult. And in fact, some ethical review committees will waive parental permission in these cases, but obviously this would have to be with firm justification. So I mentioned there that there are other ethical issues around payment. This is more of a question than an answer. Should children be compensated for participation in research, or should their parents, or should anyone be compensated? And what are the risks and benefits of payment? This is something that there's no one correct answer and is often contextually defined, and in fact where the IRBs, institutional review boards, often are very important for making decisions. Protection. An important consideration is whether all the risks are well understood and whether an appropriate and effective protection or referral system is in place to mitigate any risks. So here, the effectiveness is important because it's all well and good putting together a referral system, but if the referrals are harmful or not helpful, then they're not effective, and therefore you can't comfortably say that you had a referral system in place to respond to the risks that a child might have experienced by participating in a study. And importantly, where does the study's responsibility end? What if you are, for example, doing a study on violence against children, you realise the child is in a violent situation which ideally they should be removed from? Is the study responsible for finding them alternative accommodation? What if the child protection system is weak? To what extent does the study and the researcher, where does their responsibility end? Is it just simply to make sure that any sort of immediate risks are mitigated, or what about the longer term implications of the situation that the child is in? And privacy is another important ethical consideration. All research should be conducted in a safe and private location. But this has implications, particularly for children, when taking them from their normal habitat. Children are often in school or at home, and if an adult who's not a teacher or a parent or a relative or someone who's known to the community is taking a child somewhere to be able to access a quiet and private location, this could increase the curiosity and attention as to who they are and why the child is being taken, which could be harmful, depending on how the community or those around them react to that. And it's also important to be clear on the limits of confidentiality. So, for example, if a child protection concern is raised, you can't be confidential with that information. You need to be clear that that would be passed on, and as a result, confidentiality would be breached. We also need to consider particularly vulnerable children, for example, those in conflict situations or those living on the streets, children with disabilities, and the ethics of excluding their views and experiences on issues that affect them must be carefully considered. This also has implications on their ability to provide informed consent and also to access child protection. And this isn't just related to child protection-related research, but also in non-research situations. We recently have, as the Gender Violence Health and Health Centre, done work with the International Centre for Evidence in Disability here at LSHTM and found that there were key barriers to children's with disabilities' ability to access child protection related to communication, physical access, being able to independently access child protection structures, attitudes and misconceptions about what was entitled and what they were capable of, but also poverty and exclusion, because children with disabilities were often from households which were especially poor. So again, how and if you are trying to understand the experience of children with disabilities, how best to ensure that they are not only able to access the study in terms of communication, but also any child protection activities that may need to follow. As I mentioned, researchers' welfare is also a very important consideration, both physical and emotional, and it's important to consider these factors as they may affect researchers' ability to respond appropriately to children. It could affect their well-being and safety during and after the study, but importantly, it may also affect the quality of the data collected and the integrity of sampling procedures. So if they anticipate that a particular child may be disclosing distressing information which they are finding difficult to deal with, they may choose not to, or they may skip a child who would otherwise have been sampled had that not been the case. Yeah. So yes, as I mentioned, I'll be presenting a short case study on how to manage harm, and this is the experience of procedures in the Good School study in Uganda. This is led by Karen DeVries, who's a senior lecturer here at LSHTM, and with partners in Uganda, Raising Voices, which is a Ugandan-based NGO that works to prevent violence against women and against children. And when I say how to manage harm, this isn't the only answer. I'm sure there are lots of other things we could have done, but this is just what was done in the case of this study. So just as a brief overview of the study, the Good Schools Toolkit is a whole school intervention that was designed by Raising Voices and seeks to reduce violence in schools. So this evaluation was to evaluate the effectiveness of the toolkit, which it was found to be very highly effective. And this was conducted in a district close to Uganda and involved a randomized controlled trial, qualitative evaluation, as well as a process analysis and economic costing. It involved 42 schools, and we interviewed students, teachers, other school staff, so dinner ladies, matrons, guards, and so on, school administration, as well as parents and carers. And we were interested in their experiences of violence, an assessment of their mental health, and also performance in standard educational tests. So how did we go about this? In terms of assent and consent, we first obtained permission from the Ministry of Education and Sport at the national and district levels, so that the educational sector was not only aware of it, but was consenting to the study. This was important, not least because corporal punishment was banned in schools in 1997, and we were keen to understand violence in schools. We then had a 3-tiered consent process for the actual study participants. Consent for participation was sought from head teachers, and they consented for their school to participate, and also for the study to approach parents and students, and all head teachers and schools that were approached agreed to be part of the study. Parents were then given an opportunity to opt their children out of participation. So they were given the opportunity in person, on the phone, in writing, and then also in community informational meetings that were held about the study. And we were aware, the parents were also aware that questions related to violence would be asked and that some questions might be upsetting to their children. They were also made aware that if their child disclosed anything there was that raised concern about harm, we had an obligation to report that. And we also emphasized that their participation was voluntary. Now, in terms of individual students and staff, the students who were selected to participate in the survey were approached and informed assent was sought. And this emphasised that their participation was voluntary, that we had an obligation for reporting, and that we also made them aware of the availability of referral services should they need any additional support or if the researchers had any concern about them. And again, with staff, they provided informed consent. And those who provided assent were those who were under the age of 18. So, as I mentioned, an important consideration is also how well equipped the researchers are to conduct the study. And so we paid a lot of careful attention to recruitment and training. As part of this, we selected for experience of previous work with children and asked for specific references around that. In other contexts, that would have been a CRB, a criminal review board, check with the police, so essentially a check with the police if they had any concerns about this individual's participation in the study working with children. We then conducted 3 weeks of full-time training, including issues around violence against children and child rights, and also strategies to maintain privacy and confidentiality, which in a school setting is not easy always. If you have a small compound and several children, where and how do you find a quiet place where a child will feel safe to be able to disclose potentially difficult situations and experiences. They were also trained on consent and also techniques for building rapport and making children feel comfortable. An important emphasis was on role-playing, particularly on interviewing techniques, handling disclosures of sexual violence, handling disclosures of violence, and to ensure that if they were to hear anything from a child, that they were equipped to deal with that in a sensitive way. We also felt it important to ensure that they were aware of strategies of remaining non-judgmental so that the child didn't feel stressed or whatever at having disclosed something. An important emphasis was also the child protection protocols. And we interviewed an excess of interviewers and hired the best so that we weren't tied to having to hire everyone who had been trained if we later assessed them not to be an appropriate researcher for this study. As I mentioned, we had a child protection protocol, and in terms of referring children who experienced violence, the study employed a counsellor who was full-time and was there to respond to any child protection concerns or counselling concerns that may have arisen. And there was also a comprehensive protocol to handle disclosures of violence, and it was developed in consultation with local child protection experts and services. As I mentioned, it's all well and good having a very good referral system on paper, but if it doesn't actually work in practice, then you effectively don't have a referral system. And this protocol guided researchers through specific pathways of action depending on the severity and time frame of what the child had disclosed. So the top level was urgent. So this was often things that needed to be responded to within 72 hours. So this could have been sexual violence so that they could access post-exposure prophylaxis or emergency contraception, or if, for example, there was a visible wound that had been that the researcher could see or the child had told them about. The second level was serious but less urgent. So this could have been, for example, sexual violence that had happened more than 72 hours ago. It's still extremely serious, but there wasn't, for example, the opportunity to provide post-exposure prophylaxis or contraception, or if a wound had healed. Again, very serious, but there wasn't a need to take them immediately to a health centre. And the third level was serious but not urgent. So this could have been something that happened a year ago or a term ago, or something that was of real concern but didn't need to be addressed immediately. And this was simply because of the need to ensure that the system was able to respond appropriately rather than just, for example, saying that everybody will be seen within 24 hours. That would not have been feasible. And decisions on disclosure that would necessitate referral to and where they would be referred were made considering the legal requirements in Uganda, but as I mentioned also the local child protection systems. Now, in practice, at baseline, there were very high numbers of referrals, and this then obviously required us to refine that. So at follow-up, mental health impact was added to ensure that referrals were responding to children who were most at risk or had ongoing mental ill health from their experiences either in the school or outside of the school. And an assessment of the referrals showed, and the child protection showed that they were well received by students. One of the references I included responds and shows how the children experienced it and what they felt of the participation in the study. As I mentioned, interviewer welfare is also very important. So as part of the trial, an LSHTM student was attached to the study, and her work measured signs of vicarious trauma amongst the researchers. And as part of her study, there was specific space provided for critical reflection through team debrief. So this was an opportunity for researchers to speak about their experience, to think about their experience, to share in a safe space about how the study was affecting them. There was also space provided to decompress through group social activities, movie watching, and researchers were randomized to either the debrief or to the movie watching. But researchers in both groups found the activities to be enjoyable and useful. So it was a valuable addition to supporting them if they had or when they had any challenges related to participation in the study. Now, as I mentioned, there are a number of resources. You won't obviously be able to see them all, but this will be recorded and will be available online. So all that's left for me to say is thank you very much for participating, and I look forward to discussing with you all.
Hi, thank you very much, Nambusi. We have about half an hour for questions and answers. I'm guessing there might be several. So why don't I start off with one? I was wondering, with the referrals that you did make, especially in the early phase, and there were several referrals, how did things play out if there was a referral, for example, for abuse by a teacher, and how did that impact the ongoing research and your collaboration with the school?
Mm-hmm. Thanks. That's a very good question. If there was a situation of a disclosure of violence with a teacher in school currently, then the system was. It depended. It depended on the type of violence and the situation in the school and when it had happened and so on. In some cases, the teacher had been moved on, or the child had talked about a previous school. But essentially, in the baseline, an immediate response was made to address the violence or the allegation of violence. In some schools, the system, some teachers complained, or some head teachers complained, that they hadn't had an opportunity to address it before the study had intervened, and it was felt that the study had gone in too quickly. But essentially the welfare of the child was a primary concern. But because there were staff, the counsellor and the organisation in Uganda who were supporting the child protection system, because they were trained and equipped to provide the support, though there was in some cases some friction or tension with the study, what was felt intervening where the head teacher should have addressed it. Essentially the welfare of the child or the children was the primary concern.
So my question was regarding ensuring child protection during research conducted by NGOs or non-profits. Because usually we have our partners doing research, non-profits doing research, but there is no institutional review board or anything, any such mechanisms to ensure that children are protected within these settings. Any guidelines that you can follow in such situations?
Thank you, Mitzi. Yes, I think that's a very important and very good question, because particularly if an NGO or a non-profit is doing research, they may not, for example, have people who are specifically trained on research. In my experience, and a lot of the research I have done has been with NGOs, not only are all the guidelines often freely available online, but importantly, institutional review boards will review any study, not necessarily only those that are linked to the institution. So, for example, the study that we did on child protection in Uganda was reviewed by a review board that had nothing to do with the study. It was the Mildmay Review Board. So I would encourage, even to the extent possible, researchers and civil society to work together on reviews, and if necessary to submit the application to a review board. It could be in a university, it could be a lot of admittedly larger civil society organizations have their own review boards, but essentially I think it's important that somebody or a group of people who are aware of the guidelines and who are aware of ethical concerns do review a study before it goes. In fact, some funders, it's an absolute requirement, and some journals also will not publish results that are not reviewed by an institutional review board. Admittedly, again, not all civil society research is for peer-reviewed journals, but the same issues apply, and in most countries, institutional review boards can be approached to review a study.
This is David Curry from the Division of Medical Ethics at NYU in the States. Thank you for the comments you just made, because one of my questions was around, I wanted to note that you didn't happen to mention institutional review boards, ethics review boards in your presentation. My specific question was whether the review board that looked at the case study raised any challenges. It sounded as if your protocol was quite complete, but I think more important, and in our work with nonprofits who are conducting things ranging from M&E to research which has formal protocols and random clinical trial dimensions, unhappily, much of the NGO world, while conducting what nominally might be called research, may not find themselves in a convenient position or may not have retained an academic researcher where there's an IRB already involved. So we believe it's a very strong area for development that some level of competent, independent ethical review attend these kinds of research efforts as a matter of course. The second quick comment, and it was really a question about your case study, we have observed that one good diagnostic about whether an informed consent process is as resilient and well-designed as it might be is the rejection rate or the decline rate. In short, if everybody says yes and no one says no, then that may be a signal that either the research perhaps is not penetrating enough to be warranted in the first place, or that the informed consent process may need strengthening because information about risks and harms may not be. If nobody says no, that's an unhappy signal that probably should bear additional investigation. So my specific question was whether in your case, what the rejection rate or the decline rate among parents and children was in your case study, if you would be able to share that. Thank you so much.
Great. Thank you. And those are two very good questions. Yes, I neglected to include the study was reviewed by the Ethics Review Board of the London School of Hygiene and Tropical Medicine, and also by the Uganda National Council for Science and Technology in Uganda. But yes, absolutely, what you're saying about the importance of standardized, or at least somebody with an ethical lens reviewing all research, whether it's done by an academic institution or a non-academic institution, is very important. And as I mentioned, there are guidelines which, if an NGO, for example, is conducting research, if they're cognizant of those guidelines, at least then in the design of the protocol and the tools, they will at least have been aware of issues that they should be considering. And then in response to your second question, as I mentioned, no schools declined to participate, and only a small hand, I could check the exact number, but very, very few parents opted their children out. This might also be sort of characteristic of the context where the schools that were participating in the study were in a low-resource setting, and an NGO was bringing a program that was expected to, or was hoped to, improve situation in the school. So there was a lot of enthusiasm in being part of the study. So I can again confirm, but I don't remember that any children declined to participate, or at least didn't didn't explicitly decline to participate. In the qualitative evaluation, there were a few children who, in theory, assented to be part of the study, but then when asked questions weren't very forthcoming, and so in that situation the researchers stopped the interview either after assessing whether there were any sort of child protection concerns while the child might not be willing to speak, but where there were no concerns, we took that to mean that the child was unwilling to take part because they weren't very vocal. But overall the rejection rate, as I mentioned, was quite low, and in part that could have been through excitement and anticipation and hope and expectation about what this new NGO study or this new NGO intervention might mean for them and their school.
Yeah, this is Farooq from India, and my question is that what is the process? Like these institutional review board might be very medical savvy and might be reviewing the protocols which come from very biomedical or that sort of background, and may not have reviewed the protocols which are about the researches involving children. So what do you do in that situation?
Yeah, no, I think that's a brilliant question, a very good question. A lot of the ethics review boards can be either medical or very epidemiological, and in fact qualitative research with its particularities, for example, the ability to ensure anonymity and confidentiality is a bit hard. So for example, if you are interviewing a district chairperson who is responsible for health, then it's not that hard to figure out who that individual will be. So often ethics review boards are very sensitive to issues around anonymity, and qualitative research with much smaller numbers have difficulty sometimes in convincing ethics review boards that they will be able to maintain confidentiality. But as a broader issue, when considering how to overcome that, I think it's important to be clear on what you're doing and how you're doing it and why you're doing it, to be able to provide a robust response. So yes, they will probably highlight issues related to the fact that they are coming from a very particular disciplinary perspective. But then for qualitative research or for work with children or whatever issue, particularly sensitive issues, it's important to provide a robust response and to provide evidence. So quoting other studies that have used a method that is similar to yours, or ensuring that you can prove that a referral system is robust and will be able to respond adequately, often allays the concerns of ethics review boards. But you have to also recognize and accept that sometimes some of what you may want to do will not be approved because the board won't consider it to be appropriate. In the study we were doing on transactional sex in Uganda, we had hoped to, specifically for emancipated minors, to waive parental consent because we were asking about their experience and decisions around transacting sex. So asking a child to send or give their parent information sheet and consent form to talk about their sexual activity. The parent mightn't have even known that the child was sexually active. We were concerned that that might cause distress or concern for the child or even risk or harm. But the review board insisted that we would require parental consent. So we proceeded with parental consent and informed the parents that we were interested in understanding young people's relationships, including physical relationships. And then those parents who consented did, those that didn't. And we also don't know if the child said their parent didn't consent, or if the child didn't even give the form to the parent. But whatever the case, if the consent form didn't come back, then we were not able to interview that particular young person.
David Curry, I don't want to get in front of anybody else's question, but I might be able to add a perspective on the exchange that just occurred. We did, commissioned by Wellcome Trust and DFID a couple years ago, an ethical framework on health research in humanitarian context. But in the context of doing that and in speaking with many NGOs, I think the name was Farooq from India raised was a slightly different question than what was answered, although the answer was instructive in its own right. The question about let's use the word carefully, competence or the range of an IRB that may be in an institution or may be independent to address the particular nuances of research that may be going on with children, with vulnerable children, or research designs that may fall outside of the norm for what the institution might be reviewing in the most part, and the difference between academically based institutional review boards, national regulatory bodies. I think it's a fair observation, at least we took away from our experience of developing the ethical framework I mentioned, that we do not have strong continuity across the various layers of ethical review bodies, and we do not have good continuity in terms of the range of the normal kinds of protocols reviewed, so that even as we recognize that research to be conducted by NGOs really must seek and ideally have competent, independent ethical review as a matter of course, for ethical reasons, for reputational reasons, for all of the reasons you could list, we do not have, unhappily, an infrastructure of ethical review bodies that are convenient, uniform, and competent in the sense of being nuanced to some of the questions that may be raised. So the example that was just given, where the IRB declined to provide a waiver, if that would be what it would be called, so that children could assent and give information independent of parental consent, would be a good example of where of a signal where that might not be working well. We have, I'll just close with this, in our Division of Medical Ethics at NYU, we have been actively discussing this problem, and we have even been talking, and I just raised this as an idea, about what it would take to create we are using this term loosely, a virtual IRB, which might convene, especially for research with vulnerable populations, and especially for research in developing nation contexts, an IRB which could gather for at least an important part of its membership those in the field with particular competence in the area of study, and to both have a quick response and a portioned membership that could do more than simply give IRB assent, whether the IRB is well positioned to do so or not. So this is an idea in early stages, but we were startled in our work to find that so few NGOs, except where they have contracted an academic so that there's a trigger for an academic IRB to have to be involved, how many preferred to avoid what they perceived as a lengthy and troublesome process to get an IRB approval, and if they didn't have to, or if there wasn't a sufficiently mature national regulatory authority to insist, they tended to proceed based on their best judgments and best intentions, which obviously is a standard below which we should be aspiring to. So please excuse that extended remarks, but we have been so perplexed on this, we have thought about what it might take to establish and convene a highly flexible IRB that could run in parallel and perhaps provide an assessment of a research protocol that could later be used with institutional IRBs or national regulatory IRBs, et cetera, but try to provide the kind of responsiveness and competence that seem to be challenging for many NGOs to engage the process in the first place. Thank you.
Wonderful. Thank you. Thank you, David.
So there's one question from Ada from Zanzibar, and Ada is asking, how do you deal with expectations of payment, both from individuals or institutions involved in research?
Thank you, Ada. Yes, no, it's a very good question. And ethical research requires that participation is voluntary, but also that there is no undue inducement to take part. So if somebody would have not been willing to participate in a study and then you offer them, I don't know, $100 and they say, okay, yes, now I'll participate, that's an undue inducement to take part. But often studies make provision for compensation, a time compensation or a transport refund. So if, for example, in the time you're taking part in the study, you're not doing your sort of day job, then there is a provision and it's considered ethical, so long as it's not an undue inducement to take part, to compensate in a way that isn't the reason that somebody takes part. That can be difficult if people, particularly if you've participated in a study before, you know that you may get resources. You could get a situation where people name the amount that they want in order to consent. But if somebody is appearing to wanting to be paid, then it's a decision for you to make about how important it is and how appropriate it is for that individual to be part of your study. Ethics review boards often also need to be facilitated because they don't exist in isolation. They exist as part of an institution. Usually review costs aren't that high, sort of like $200, $300, $400, something like that, which, to be fair, in some contexts and for some studies will be a very high amount, but so long as it's a standardized amount, then it's not unethical to pay a review board to review it because the people who are doing it have to be compensated for their time. I know of one country where the review board fee is calculated as a percentage of the overall study budget, which has in itself concerns. It also means, for example, that researchers may have an incentive to to only submit the bare bones of their budget because it's calculated at 10%. So if you're doing a large trial that is $600,000, then $60,000 is just the review fee if it was a 10% calculation. So it's something that is important to be clear on and important to be explicit and transparent about, but it's also something that doesn't necessarily make research unethical.
Okay, we have, I think there's a question from Lucy Jamieson.
Hi there. I wanted to know about because your research was done in Uganda and you're in the UK. And, I mean, the requirement is that you have ethical approval in both countries. So I wondered how you'd manage that process.
Great, thank you. Yes, great question. In fact, it's unusual that I'm in the UK. I'm actually usually based in Uganda. But the London School of Hygiene and Tropical Medicine, as an example, provides ethical consent or ethical approval on condition that you then get local approval as well. So if you don't get one or the other, then you can't proceed with the study if you are a staff member or a student at LSHTM. In fact, a lot of different institutions have similar requirements. In Uganda as well, it has to go through the National Council, so they also have to approve. But at the end of the day, you also, if, for example, you are not in the country in which you're conducting the research, you can work through partners, so it doesn't necessarily mean that you have to go yourself to submit for ethics and so on. But it is important not only to get approval from the institution that's conducting the research, but also from the country. There are concerns where there are countries that, for example, don't have functioning review boards available, and what David was mentioning there about a virtual review board I think is a very interesting idea which could have merit, particularly in contexts where there aren't review boards available. But yes, I'm usually based in Uganda. I'm just over in the UK for a few weeks at the moment.
Okay, and we have a question from Katie Murphy, who says, thank you for your presentation. I'm part of an NGO that now has a functional IRB to review research protocols. One issue that we have confronted is the lack of control mechanisms to ensure that the researcher is adhering to protocol. For example, ensuring that there are trained counselors available for cases that require referral. Do you have any advice on this? And Nambusi, just since we're running, we're nearing 2 o'clock now, I'm going to throw a second question at you at the same time that came in a bit earlier. There's a person who's conducting a survey in Indonesia with children. I don't have the details in front of me, but they had been asking about whether they need to provide training to their researchers. When I train the enumerators for taking data, shall I train them about ethics as well?
Great, thank you. So taking the first question, I think it was Katie's question first. If I remember correctly, you were asking whether lack of control mechanisms to ensure that the researcher is adhering to the protocol. And I think this comes very much in the training and supervision of the researchers. Now, I don't know if you're talking about the researchers who are doing research for the NGO that you work, or if you're providing ethical review for other NGOs and therefore they're not able to review what they're doing. But essentially, the way in which this should be managed is through the training of the researchers, so they're very clear on what's expected on them, and importantly, why. If you're convinced of why you should do this or that, then it's perhaps more likely that you will actually do it. But then ensuring that there's an appropriate supervision structure in place so that where there are any deviations from ethical protocols, that they are picked up and responded to, which obviously implies a monitoring of the system. I'm assuming again that you're talking about your NGO providing ethical review for other NGOs or other organizations, and that is something that your review board should ideally have, should make provision for reporting of any adverse events. So if the supervisory structure of the study recognizes any adverse events, then they should be required to report it to you and your IRB to ensure that you are aware of any issues, but also to for learning for the NGO and also for the IRB going forward how to manage that in the future. And then in terms of the second question on the research with children in Indonesia, yes, absolutely. The researchers should be trained on ethics, again, so they understand what they're doing and why they're doing it, and also understand what ethics is. Not that it's a tangible thing, but to understand the implications of why they should ask a question in a certain way, why they should ensure, for example, there's privacy, their responsibilities, the expectations for reporting, and so on and so forth. In fact, research on violence often is recommended. There's a WHO guidelines on ethical research on violence against women, and also UNICEF guidelines on violence against children, and both very much emphasize good quality, detailed training, and again, which includes role playing, which includes participatory activities, so that researchers are very much supported to conduct good quality ethical research, not only for the purposes of the study, but importantly for the welfare of the researchers and the study participants or respondents.
Thank you. Nambusi, if it's okay with you, maybe we could take one last question. It's just about 2 o'clock now, but Farouk, if you wanted to ask your final question, and then we can close out.
Yes. My final question is that can you please illustrate all the steps, very briefly, all the steps which involve doing a ethically research? I mean, from the very beginning, developing a protocol, showing it to the IRB, and then training. So very briefly, if you can just tell all those steps, one thing. And second thing, that when we are submitting the protocol to IRB, then what all should that protocol have?
Great. Thank you for those questions. Very useful, but you did very usefully emphasize briefly, but unfortunately I won't be able to go into great detail at the moment. But that's why guidelines are very important. These ethical guidelines, these are just a few that I selected related to research with violence against children, but these guidelines provide information on the steps to go through. So as I mentioned during the presentation, research ethics and methodologies are closely linked. So as part of the protocol development and the tool development, you need to ensure, for example, that you are aware of particular risks that might take place. What I would refer you to is these guidelines, and then also ethical research involving children, the ERIC, and also depending if you're where you're doing it, the country or the sector that you're doing it may have specific guidelines. But essentially, if I were to summarize it in 3 steps, it's firstly making sure that your protocol and your methods are ethically sound. Second, to make sure that your training and support to researchers is appropriate. And then thirdly, to make sure that your referral system is responsive, robust, and effective in light of the child protection system available to you in the context in which you're conducting the research. I know that's not answered your question at all, but what I would say is please refer to these guidelines which provide advice on how to develop and conduct ethical research.
Yes, my second question was that, what all should the protocol have when we are submitting it to IRB?
That's something that will be in the ethical guidelines, because depending on what your research question is, depending on your study context, depending who you're interviewing and so on, there's no one rule for every study in all contexts. That would all be designed in your study, and the guidelines will guide you on that.
Okay, thank you very much.
You're very welcome.
Okay, thank you. Thank you, Nambusi, and thank you to everyone for joining in and asking your questions. Really an engaging presentation, Nambusi, and I think relevant to a lot of our work. We're going to go ahead and wrap up, but we'll be sending out a link to the recording of the presentation, which will have the slides and the audio. So we'll send the link to that in the next few weeks in case there's anything that folks would like to review or to share with your colleagues. And we can also, Nambusi, if it's okay with you, we could share your email address if people have maybe follow-up discussions.
Sure, yeah, absolutely. Please do. And at the end of the slides were some resources. I included a link to a few resources which may be of interest, both papers. So, for example, there's a paper there on responding to abuse, the experience of the study that I outlined, but then also some of the guidelines, ethical principles, dilemmas and risks in collecting data on violence against children. That's a literature review, and then also work by UNICEF on guidance and advice on how to conduct ethical research. So yes, please do review those resources, and I'm also happy to receive emails as well.
So thank you again, and we'll look forward to seeing you at the next webinar.